We are Group 5, and our assigned topic is all about autonomic and peripheral nervous system. The peripheral nervous system includes every part of the nervous system that isn't the brain and spinal cord. There are subtypes of these, one of which is the autonomic nervous system. This is a network of nerves throughout the body that control unconscious processes. It is always active, even when you're asleep, and it's key to your continued survival. One of the disorders classified in this system is postprandial hypotension. This is about the dropping of blood pressure after eating caused by blood pressure changes while digesting food. In place of Labangal, there is this girl named Triksha. Triksha is 29 years old. Her lifestyle is not healthy, especially her intake of food. Triksha's body looks normal from the outside because of its size, but internally it is different. She eats uncontrollably, and after eating she will go to her bed and do things that she enjoys. Eating a large meal can affect your sleep, your weight, and your organs over the short and long term. Her mom noticed something was wrong with Triksha. He was scolded because of laziness even in doing light exercises. Oh, may problema. Yan kasi pwedeng igalaw-galaw mo naman ang katawan mo dito sa bahay kahit mga simpleng gawain lang naman, Triksha. When she stands, her surroundings suddenly spun and she fainted. The nurse is with the doctor as they leave. Balikan ko lang po kayo mamaya at kung nagising na po siya, huwag kayong mag-alinlangan at tumawag sa nurse station. Triksha woke up in an unfamiliar place. Her mother and father are on her side already. When she woke up, her mother immediately called the nurse. Magandang hapon po. Ano nga pong pangalan nila? Triksha Pagawon po. Miss Triksha, ano pong nararamdaman niyo ngayon? Kanina po, ano pong naramdaman niyo bago kayo mahilo? Bago mahilo? Medyo pumikit ng ulo ko, tapos umabli ang paningin ko, tapos umikot na bigla ang paligid ko. Palagi na ba ninyo nararamdaman itong mga sign na ito? Na-explain na po ni Doc sa mama niyo yung nangyari sa inyo, pero para mas malinaw, ang pagkahilo niyo po ay dahilan ng pagbaba ng inyong blood pressure pagkatapos kumain. Ang blood pressure po kasi natin nag-iiba base sa kung anong ginagawa natin sa araw at gabi. Sa ngayon po, under observation po kayo. Since may mga symptoms po kayo nararamdaman, hintayin lang po natin advice nito. Sige, yun lang po. Salamat. Magandang hapon ulit. Sige po, Nurse, Doc. Salamat. Upon taking her health history, it was found that she has hypertension. due to her repetitive symptoms based also on her subjective data that caused to be severe symptoms. The doctor prescribed the medication under injection of octreotide sandostatin. Finally po, uuwi na po kayo. Masaselebrate nyo na po ang New Year nang walang iniinda. Kaya lang po, meron na po tayong dapat tandaan para po hindi na po maulit ang naramdaman nyo. Kailangan na po i-change ang lifestyle para po healthy living na po kayo. Strict siya. Kumain po kayo pero hindi na po pwedeng pasobra. Tapos po, low carbohydrate po tayo. Tapos po, sanayin po kapag pagkatapos kumain, maglakad-lakad para po ma-proper digest po ang kinain. Iwasan na rin po natin pagkatapos kumain ng paghiga kasi po ang stomach acid niya nang tataas. Tapos maghihirapan po kayo lalo na kung may acid reflux po kayo. Since may tinitake po kayo for your hypertension, ayon nga po kay Doc, may adjustment po para inumin na ito. Iwasan na po itong inumin bago kumain. Lastly po, stay hydrated. Pag-iinom ng tubig ay makakatulong para maiwasan na po ito. Kung meron na po kayong nararamdaman, ulit, check up po kayo immediately. Pero in the meantime, blood pressure monitoring po kayo sa bahay niyo. Meron po bang marunong sa bahay niyo kumuha ng blood pressure? Mas mabuti, so far po yun lang naman po ang mga habili ni Doc na dapat po nating tandaan bago po tayo umuwi. Stay healthy po ulit, strict siya. NCP about the disorder in the scenario. Assessment. Subjective. It was verbalized by the patient. Objective. Noted dizziness, temperature 36.5, respiratory rate 12 beats per minute, pulse rate 110 beats per minute, blood pressure 90/80 millimeters of mercury, occurs 1 to 2 hours after eating. Diagnosis. Hypotension related to dropped blood pressure as manifested by syncope. Evaluation. The goal was met because after 8 hours of nursing intervention, the client has no dropping in his blood pressure and feeling of dizziness is prevented. Interventions. Review medical history and symptoms. Get baseline of premeal blood pressure reading and then a postprandial reading. Pressures may be taken at several intervals following the meal, starting at 15 minutes and ending at around 2 hours after eating. Health teaching about lifestyle changes for healthy living, such as teaching how important healthy diet, doing exercise, even just light exercises, and walking after a meal may also help counteract a decrease in blood pressure. However, be aware that blood pressure may drop once walking stopped. Dosage of medication is depending on physician's order and also to the patient's body action. Administered properly the medication prescribed, especially injection type. It is administered subcutaneously. Explain to the patient what are the effects of the medications administered for her awareness, especially the adverse effect. The adverse effect that will be expected are diarrhea, low stools, nausea, abdominal discomfort, sinus bradycardia, and hyperglycemia. Note for contraindications such as hypersensitivity. Monitor for hypoglycemia and hyperglycemia because octreotide may alter the balance between insulin, glucagon, and growth hormone. Patients are advised not to take antihypertensive drugs before meals to avoid contraindications or any toxicity.